his opening statement, and I would ask any other committee members to try and keep their statements short. But before I turn it over to my ranking member, I understand it is his birthday today, Senator Burr. So welcome. I am glad that you are spending it with all of us. I'm sure you have other ideas, but we are glad that you're here with us today. So, Senator Burr, if you want to go into your opening statement.
Thank you, Chairman Murray, and it's good to have you back. I wish the outcome of the super committee had been different, but I know that on both sides, members committed a lot of hours to try and to complete that process, and it shows how daunting the task is. And I thank you for the kind birthday remarks, but I have now reached the point where I enjoy this versus the alternative, but I just as soon not count the numbers as they add up. I want to thank you for holding this important hearing today to examine the barriers veterans face in receiving the mental health services from the VA. I welcome all of our witnesses. It is insights from people like you that help this committee truly do our oversight duties. As you know, this hearing is a follow-up to the July 14th mental health hearing, where serious issues were raised by two of our witnesses, Andrea Sawyer and Daniel Williams, about problems assessing appropriate VA mental health care. VA told Daniel and Andrea's husband, Lloyd, that they would have to wait months to see a provider. Then when Lloyd was finally able to get treatment from the VA, we were told there was no coordination of care among his providers. Unfortunately, their stories are not unique. I continue to hear from veterans about the problems they run into trying to get mental health care. As the chairman mentioned after the last mental health care hearing, she requests that the VA conduct a survey of the mental health care providers to try to get to the root of the problem. The results of the survey confirmed what we already knew, that some veterans have a very difficult time in getting an appointment scheduled. This is simply unacceptable. The men and women of the armed forces suffering from the invisible wounds of war deserve better. So today we'll again look at what's causing these problems, why they haven't been fixed, and more importantly, when veterans will be able to get the appropriate and timely care that they need and deserve. At a hearing in May, Dr. Zeiss indicated that the VA does have the resources it needs to meet the mental health care needs of our veterans. In fact, in fiscal year 2011, Congress appropriated $5.7 billion for mental health care services, a 25% increase over the previous year's budget, and a 136% increase since 2006. What has VA been doing with the resources Congress has provided over the years? Also, as VA's testimony points out, there's been a 47.8% increase in mental health staffing since 2006. Yet, in a VA's Inspector General's report published earlier this year, the IG reported that only 16% of the sites they visited met their staffing requirements for mental health care. Why haven't these staffing increases been effective? To top it all, VA's response to the survey was to put together an action plan, to develop a plan to address the issues raised by VA clinicians. What is the plan of action the VA outlined? Focus groups, audits, and publishing yet more policy guidelines. The question is, how does this help our veterans in need of mental health care services today? How does this action plan help veterans waiting to get follow-up treatment? As Dr. Hogue will testify today, 70 to 80% of the patients diagnosed with PTSD can get better. Let me stress that. 70 to 80% can get better if the patients are able to get the care and continue with the treatment over the long term. At VA, however, veterans may get their initial visit, but many are not able to get the ongoing treatments that they need. What's really troubling is the problems we'll hear about today are not different from what we've discussed at the July 14th hearing. I had expected that 4.5 months would have been enough time for the VA to come up with solutions, but it appears that that's not the case. As we'll hear today, aggressive steps must be taken, and they must be taken now. And if VA is not able to provide the appropriate care to veterans in a timely fashion, VA should consider sending veterans to someone who can help them promptly using their fee-based authority. Madam Chairman, I am confident today that this is not one you're going to let get away from us. And if VA believes that this is going to be a once-a-year topic of a hearing, let me assure you, it's not going to be. The fact that we're 4.5 months down the road and the response is to do focus groups and to put out new guidelines, to me is unconscionable, given the fact that every medical professional that's come before us says the most important thing is to get these service members into treatment, keep them in treatment for as long as it takes to take that disability and to drive it as close to zero as we can possibly get it. My hope is that the committee will recognize the fact that we have funded, and now it's a process of execution that we've got to seriously look at. And I pledge to the chairman to work side by side with her on this. I thank the chair.
Thank you very much. Appreciate it. Senator Kaka?
Thank you very much, Madam Chairman. I